Good evening to you all. I welcome you to this wonderful occasion. It's a period where the Southwest is celebrating the health of Ghanaians. Southwest Ghana Conference. We are going to take you through a journey for these 4 days. We are going to look at various diseases that affect the people of Ghana. We are going to then try and link it to what the Bible teaches. Today we're going to look at chronic kidney diseases. We are going to look at a disease that is on the rise. I was very surprised when in training I realized that almost every single day someone comes in with the kidneys almost gone. God created everybody to have 2 kidneys. They are being shaped and they are in your abdomen. The surprising thing is that because they are 2, one can get damaged without you even knowing. So by the time you notice that the kidneys are gone, then you are almost gone. We want to look at what the kidneys do in the body. The kidneys are so important. They maintain your blood pressure. They control your blood pressure. So if your kidneys are not functioning, it means that how to maintain a normal blood pressure will be a problem. They are very important in keeping your bones very healthy. And one important thing that we want to re-emphasize is that they are important in removing what we will call dirt from the body or waste from the body. Without the kidneys, it means that this waste will stay in the body for a very long time and will cause damage to the body. Let's look at some statistics about the kidney, chronic kidney disease. It is surprising. You know, data from Africa and from Ghana sometimes is difficult to get. But with data we get from the developed countries, even makes it scarier. Data from the US just a few months ago is that every 1 out of 7 people in the US develop chronic kidney disease at a point in time. US nipa ensun emu baako enya sabua yadeebi. Whilst in training at the Cape Coast Teaching Hospital, Almost every day we have a patient who comes with chronic kidney disease.
Me want to see mu Cape Coast ayaresabea no. De bia da ekamia yese onipa baako eba hospital saa yade yi ena ode eba ayaresabea ho.
The worst form of it is those who develop what we call end-stage kidney disease.
Na die ehu pa ne se won a woba no ebi mu die ne de woye ho hwe a enye yie.
These are the people whose kidneys are gone and they need help.
Na safwe ene won a won sabua mienu ni nyina no aseye a wohia emmoa.
And because those people, treatment of those and the disease at that particular point is so expensive, we have to talk about this disease.
Na esan se wo pese obua safo ya eye de eka ewo mu nti no ena nanumre me pese me twenwa dwene si saa yade so na yetumi ebo ye ho ban efiri ho.
Because a few months ago I realized that when I asked from the various hospitals around who have dialysis, to put a patient on dialysis a day cost about 300 Ghana cedis.
Enche pi na me yen hwehwemu ayasabia hodo a ewo afidi a so obi hia mo a yede no to so no e kire se de bia da no se yede obi to so a kanisi kadada no 3 million ena obebo ho ka.
And normally the patient might need 3 of these in a week.
Enunti na watwi biara mu no obekwa akoda afidie so emprensa.
And so in a month you might be spending close to 40 million old Ghana cedis.
Na kire se bosome baako no be se opepepe aduanan ena obebo ho ka na odi asa saa yade yi.
I don't know how many Ghanaians can afford this.
Na minim Ghana fo dodo a ebetumi anya saa sika yi na odi akon saa okon yi.
That is the reason why every year worldwide we have a day we celebrate kidney.
Enunti na da bia da afe no do a ye yi da baako di si ho na ye de celebrate sabwa yade yi.
So what are the things that can make one person develop chronic kidney disease?
Na edien ena ebema obi akonya saa nyarewa yi.
One of the commonest things are that probably we will not know, might not notice, is hypertension or high blood pressure.
Ade baako a ebetumi akotwetwe saa yade aba ene moja moroso.
And because a lot of Ghanaians do not check their blood pressures, by the time you realize the patient has developed an end-stage kidney disease.
Yatakwa ya sabi ase yakwachichiri yensa. Esan se yentan chichiri yensa ni yenhunu yemmoja no mpempenso akodu nti ena ema yekosa tibia no mu.
So hypertension or high blood pressure is one of the commonest causes or risk factors to developing chronic kidney disease.
Nti moja mroso no eye ohaw baako a etwetwe ye de kɔ sabwa yade wanum emu.
Diabetes or high blood pressure is also another one. Diabetes or high blood sugar,
Afei esichire yade enso eye akwan baako a etwetwe sabwa yade no ede eba.
A lot of us don't check our blood glucose levels.
Yemu bebre ho a yen cheki esichire a ewo ye moja mu.
By the time we realize it's destroyed the kidney.
Enunti yeni beba ye ho so no na asai sabwa ni nyina.
One of the things we realized in Cape Coast Teaching Hospital is that a lot of people who came down with chronic kidney disease or their kidneys were destroyed had taken some herbal preparations.
Ade baako a ye nhwehwemu a yehunu ye ewo ogwa akyerɛkyerɛ ayaresabea ne sɛ nipa bebree bɛba no na wɔn saboa no asɛe na ne nyinaa gyina abibiduru a wɔnom ye no ɛso.
We are not saying herbal medicines are bad.
Yɛn kasa abibiduru nyɛ.
But make sure they are accredited by the right authorities.
Na mmom hwɛ yie sɛ abibiduru bi a wɔbɛnom no mpanimfo a wɔn nsa ɛhyɛ nnuru ase no nsa ɛda so.
People move from pharmacies or drugstores to drugstores just buying painkillers.
Ebi mu kɔ drugstore ɛkɔ akɔtotɔ nnuro bi a ɛbɛma yaw a yɛteɛ no abrɛ ase.
These NSAIDs lead to kidney disease.
Na saa nneɛma nyinaa no ɛna ɛkɔtwetwe saboa yarewa no ɛde ɛba.
These are things that you can do something about.
Na we nyina ye de obetumi aye bibi afa ho.
But there are other forms or risk factors of kidney disease that we call non-modifiable. You are not able to do something. You get it irrespective of what you have done.
Na ye wo de eno nso ba untumi nye biribiara emfa ho.
So if your family member has developed kidney disease, you have a high risk of developing kidney disease.
Eno nti so obi wo wabusua mu na wanya sabo ayarewa ni bia na ekire se ebo okokọ se wonso daachi ubetumi anya bi.
If a family member has gotten diabetes in the past or hypertension, your risk of developing hypertension and diabetes is high, which means that your risk of developing kidney disease is also high.
Se obi wo obusua mu na wanya mojamroso ene esikire nyarewa eno so kire se wonso ubetumi anya bi. Eno nti ebetumi akotwetwe nsaboa nyarewa no so aba.
It means that if you are aging, anybody above the age of 60, your risk factors is high.
Eno nti se wadi mfie aduosia ene akire a wonso ubetumi anya saboa nyarewa ni bi.
So these are things, if you are born black, you are in the black race, your risk is higher.
So we die ye tuntum se me die yawo wato abibima hu hai e kire se wonso ubetumi anya bi.
So what are the things that can tell you or give you a sign that you are developing kidney disease?
Die nsankyerene ena ba me hunu se saboa nyarewa no ye anya bi.
In fact, because we mentioned that the kidneys are two, it means that one can work whilst you don't even know the other is already damaged.
Esan se eye mienu nti ba ko betumi aye adwuma wani ma ho so se ba ko asai.
And so the only way to be sure is to check.
Eni nti kwan a ebe ma wada ho so ne se obekwa akoye nhwehwemu wa yaresabia.
But there are signs that you can see, and when those signs come, normally means the disease is advanced.
Na ye won sankyerene bia obetumi di wani ehunu na eba ne sa na kese yarewa no akọ anim.
What are these signs or symptoms?
Eno na dien o me nhwe.
You might have dry skin, itchy skin.
Ohunam no ebe ye kwawe na ebe sanso akekaw.
You might have swelling of your legs.
Wona se betatai.
You might have swelling of your eyes.
Na waniwa nso ebe hohono.
Normally early in the mornings.
Mpempi no wada asori anopatututu no bo so wani no ahono.
If it's worse, you might have difficulty breathing.
Na se ekire so a wahome no so ogi ahome a ensi so.
But once again, I want to say that these things, once you see them, it means the disease might be advanced.
Na se wuhunu we no wana je se yare no akonanim.
So the only way is to ensure that you check.
Enu nti ade abeya ne se obeye nhwehwemu ewa yaresabia.
So what are the things that we can do? What tests can we do that will help us to identify the disease very early?
Ade nhwehwemu ne ebetumi ahunu saa yade yi entem.
Not to bore you, just checking proteins in your urine.
Afei se wo hwehwe odwonso mu no eno so beboa am yehunu.
It can give us a sign that you are developing kidney disease.
Ebe me yehun sankyerene a kire se oriye anya saboa yarewa ne bi.
Regularly checking your renal function or your kidney functions can help you identify if you are developing kidney disease.
Enu nti wo tai ahwehwe se de saboa no si ye adwuma fa no ebe boa mo ahunu se saboa no ho atochema ana entochema.
But what we want to say, the main reason why we are doing this topic, and we do this every year on the kidney, is that once you develop this kidney disease and we don't do anything about it, you end up developing end-stage kidney disease, and that is difficult to treat.
Na senti afibia no ya hye ho fa ne se wodie no kwanim na ye ntumi nya ho hwe ya doctor de obeka ne se ko na kowuo.
And so we need to get ourselves tested, and we need to prevent the progression of the disease.
Enu nti etwa se ye kwa ya sabia kwa ye nhwehwemu na yetumi eso ano.
So what are the things that we can do that can help us prevent the progression of the disease, or even prevent us from having chronic kidney disease?
Ede ne ye ya ebetumi ama ya so ano ana se ebebo ye ho ban a ye nkonya saboa yarewa ne bi.
So we are saying that regularly checking your blood pressures is an important step.
Once
we realize that your blood pressures are high, we give you medications. Then it will slow progression even if you have kidney disease. Regularly checking your blood sugar levels is important. Because hypertension and diabetes together are the commonest causes of chronic kidney disease. Other things that you can also do is that you stop shopping from pharmacies to pharmacies buying painkillers and NSAIDs. Just drinking any herbal preparation is dangerous.
Sometimes
as a health practitioner, I sit in buses and people sell all kinds of things in polythene bags, in rubber bags, and Ghanaians are buying.
Polythene bags
anytime I see that, I warn them they should be careful of their kidney. Smoking, you should stop.
Cigarette nom, weed nom,
let's reduce or stop alcohol. As Christians, I believe that we will draw ourselves away from alcohol. Eating healthy goes a long way to prevent our kidneys from getting damaged. We advise that you eat healthy diets. We advise that you eat fruits and vegetables. We advise that you avoid taking red meat a lot. Some of us like red meat every day. Beef, meat. We advise that you reduce that. Some of us find it difficult to exercise. We should avoid eating simple sugars, a lot of simple sugars. At least 30 minutes for 5 days, 30 minutes a day for 5 days in a week of exercise is good enough. These things, when we do them, will slow progression or prevent us from developing chronic kidney disease. Because when you develop chronic kidney disease, we can only manage the disease, we cannot cure the disease. And one thing that is surprising, people are getting this information year in, year out, but are still doing the same things. If you don't do the right things and your kidneys get damaged, you will get to a point where we say end stage and you need dialysis or transplant.
Se when to me and show who so ye, now nya sabua ya dear ya. The air can say, as I said, obi, edene dear de mount, and I say they will to a video so.
Transplant now is very difficult.
Na se ekoba se obi be yi ni sabua ba akon de amawa e ya de a eho enna,
and it's expensive.
Ne bo so odin ye pa.
And you need a donor who would match.
Na uhia obi nso a ne sabua no ene wo de no ebekọ benkro.
Maybe you might not be lucky by the time you get somebody and you might have died.
E bia na uti anya yie. Yenya obi a odene de ebeboa no na nyame age wo nkwa afi wo nsam.
In the whole of the Western region, we only have 6 or so machines, dialysis machines, at the regional hospital.
Atoye mansirim ha nyina no sam fidie ensia pe ene wo ha.
And we have almost about 3 million people.
Na atoye mansirim ha so nipa e wo ha ye be se opepepe miensa.